So, hello friends, today we are back with our community medicine series. The topic is nutrition advice. So, there will be nutrition advice for a patient with hypertension, diabetes mellitus, obesity and hyperlipidemia, patient with malnutrition. Okay, so we are going to learn nutrition advice for four group of people. So in this video, let's start with nutrition advice for a patient with hypertension. So first, what is hypertension? Hypertension is a condition in which the blood pressure is persistently above 140 by 90 mm of Hg. So if we are planning for a nutrition advice, what should be our objectives? That first thing, we have to achieve and maintain a normal blood pressure. Okay, and we have to prevent the complications that are associated with hypertension, such as stroke, CAD, CKD. We have to maintain an ideal body weight and improve overall cardiovascular health. Okay, so this is our objectives. Now coming to dietary advice, what was asked. So dietary advice first is very important to all hypertensive patients. We say salt restriction. This is the most important. We have to restrict salt intake to less than 5 grams per day. That is equal to 1 teaspoon per day. Avoid adding extra salt at the table and limit foods which are high in sodium. So what to avoid which is high in sodium? Examples are given: pickles, papad, chips, namkeen, instant noodles, processed foods, salted biscuits, sauces. This all should be avoided. Second is increase fruits and vegetables. So to consume 4 to 5 servings per day, rich in potassium, magnesium, fiber and antioxidants. So examples of such food is banana, orange, guava, apple, tomato, spinach, cucumber, carrot, beetroot, lady's finger, cauliflower, beans. Okay. Next is whole grains and high fiber diet. Prefer whole grains and high fiber foods. It helps in weight control and improves lipid profile. So prefer whole wheat, oats, brown rice, millets, jawar, bajra, ragi, pulses, legumes, vegetables and fruits. Reduce fat intake. So you have to choose unsaturated oils. Reduce intake of saturated fat and trans fat. Avoid ghee, butter, vanaspati, coconut oil in excess, fried foods, fast food, bakery products, trans fat containing foods. Next coming to, we talked about protein, we talked about fat. Next coming to adequate protein. Include good quality protein in moderate amount. Prefer plant based proteins. Okay, so what to prefer? Pulses, soya bean, low fat milk, curd, paneer, sprouts, eggs, fish, skinless poultry. Limit sugar and refined carbs. Excess sugar and refined carbs increase weight and cardiovascular risk. So this should be limited. To reduce or avoid soft drinks, sweet, sugar cakes, pastries, white bread, maida products, sugary beverages. And adequate water intake. You have to drink at least 2 to 3 liters of water per day unless there is a restriction due to heart failure or kidney disease. Okay. Also note that you have to avoid excessive tea, coffee and caffeinated drinks. This is what will be advice for a patient with hypertension. So here is also a summary again, which foods to prefer and which foods to avoid. Lifestyle advice. What lifestyle advice will you give? To maintain an ideal body weight, BMI of 18.5 to 24.9. In Asians, we know it is lesser. Exercise regularly, more than 150 minutes per week. Stop smoking, avoid alcohol, manage stress by mindfulness like yoga, meditation, adequate sleep of 7 to 8 hours per day, regular checkup and adherence to medication. Okay, DASH diet is something which is mentioned in PAR. So what is DASH diet? DASH is dietary approach to stop hypertension. Okay, in this you include, in the DASH plate you include vegetables, whole grains, low fat dairy, pulses and legumes, nuts and seeds and fruit. Okay, low salt plus low saturated fat, low sugar, high fiber, potassium, magnesium, calcium, decreased weight. It all leads to normal blood pressure. Okay, so dietary pathway flowchart is first salt restriction, healthy diet, DASH diet, weight control, regular exercises, no smoking, no alcohol, stress control, the blood pressure will be in control and the risk of stroke, CAD, CKD will be decreased. Okay, so this was overall about the nutrition advice for a patient with hypertension.